It's a pleasure to be here, a privilege too, to be here and talk about this. I was asked to talk about an update on bovine castration and dehorning, and I thought, okay, sure, yeah, I can do that. What's new? We still take horns off, and we still take testicles off, and not really sure what I'm going to say that's new, but I'll try, because there are actually a few new things, and certainly there's a few new position statements that we should talk about related to those, even if we don't have any new techniques necessarily. So things that we're going to discuss are kind of the current ideas or methods for dehorning or even disbudding. And then we're going to talk a little bit about kind of what our ideas on castration. And this is mostly cattle-based, at least that's what I was told. So we'll talk about bovine largely. And then finally we'll talk about pain medication for both castration and dehorning separately but together in that section. So I think everybody knows why we dehorn or why we disbud, and in most cases it's a necessary practice to reduce injury to ourselves as well as the animals. Now that doesn't mean that we can't have cattle in a feedlot situation that have horns. Tipping the horns is always an option. A lot of people do that wrong, but just removing the end of the horn at a place not too far down that's not going to result in a lot of bleeding is an option for feedlot cattle that come in already with horns. And those cattle that are 6, 7, 8 months old, we probably don't need to go ahead and dehorn them. Tipping may be a perfectly good option. But if we can get to the younger calf, then disbudding is definitely the way to go. Both the AVMA and AABP recommend dehorning or disbudding at the earliest age possible, and that's really where we need to be, is trying to get this done at birth or shortly thereafter, and certainly by less than 2 months of age. And so if we can get these things while they're still buds, again, I think that's where we need to be, and that's what's preferred by the AVMA, and we just call that disbudding. Once the horns protrude from the skin and start growing and we get a base to them, then we're required at that point to remove them, which is going to involve some sort of cutting process to remove the horn as well as a piece of skin and as even a little bit of that frontal sinus bone from the skull. So general recommendations are that we get this done before 1 year of age, but certainly we need to be doing this really at birth or as close to it as possible. If we're going to do this in older animals, then general anesthesia is, in my opinion, required, or at least some sort of general sedation. We need to be using some xylazine, perhaps systemically, as well as maybe an opioid like torbagesic. And then obviously local anesthesia, which we're going to talk about a whole lot more as we get towards the end. So again, getting to them early is the key. And then working towards Pol Genetics is also something there, I think, as an industry, especially in the dairy industry, that we've not done a very good job in the past, and we need to be working towards. We've made such a selection pressure over the last 50 to 100 years in dairy cattle for production and phenotypic traits and quality, and we've really not advanced our genetic options for polled genetics. It just hasn't been a big thing, and hopefully somebody will push that along a little bit. I know there are some options out there now, but usually when you mention those to the dairy producers, they look at you like you have 3 heads, because, well, those cows don't milk very good, so I'm not bringing that genetics into my herd. But certainly we can get there, and I think ultimately that's where we need to be. The AABP has position statements on it's both castration and dehorning. I'll talk about dehorning first from their standpoint. And so obviously they're saying the same thing. Get this done in the calf as young as possible is the best way to go. It's the best management thing. And really, there's really no reason, unless the animal's sick or we've had some sort of a difficult delivery, something that we might want to delay, there's really not a lot of reason that we can't accomplish both these things in the first 24 hours of life. And the majority of dehorning that we have to do in cattle is on dairy calves anyway, and certainly we have good access to those. So when I can get my clients or to do it or let me do it at 1 to 2 days old, that's really great. If our animal's sick or there's something, like I said, there's some other stressor event that happened, then we can delay that if we need to. We've done it wrong a lot, right, for a lot of years, and we have to get away with that. And Emily talked about, you know, some of the bad images that are out there for tail docking, and some of the same things exist with dehorning and just, man, dehorning adult cattle, it's gruesome, right? And there's a lot of people that just do it wrong, and so we need to get away from those images. I want to show you this video. Hopefully it'll play. And this is actually an example of using an elastrator band on an animal that's of decent size that came into a feedlot situation to get and was dehorned. And so one of the options, I'll talk more about those in a minute, for actual dehorning without scooping or gouging out the horn and some of the skull tissue is to, some people put a band on, which I never recommend, and I don't think we should ever do. And if you didn't think about it before watching this, this animal just had a band applied to it. So. Not very happy, right? Obviously that hurts, and so when we get these animals with big horns like that, we have to be telling our clients not to band them. If this animal really needs to be dehorned, then some generalized sedation, local pain management, systemic pain management after the procedures where we need to go if simple tipping isn't an option. So it's a pretty painful thing. To continue on with AABP's position, ideally we want to remove those before they get 1 inch diameter, where we can use our small Barnes dehorner to take those off. Once they've grown larger than that, then AABP recommends that we just leave them in place and tip them if necessary. So again, you're going to keep hearing me say it, young is where we need to be. Calves should be restrained for dehorning and castration, which we'll talk about in a minute, in a way that reduces risk to injury and also risk to the people doing it. Some chemical restraint, again, some generalized sedation may be necessary. If we do these calves as babies, we don't need any generalized chemical sedation, just local anesthesia as well as systemic pain management is enough. We need to have the right facilities, we need to have the right procedures, and have our people trained. Now that may be as simple as a halter. Lord knows I've dehorned plenty of calves with a halter tied to a gate, and with the right local anesthetic and the right general or systemic pain reliever, that works just fine. Obviously we'd rather have them in a chute or in a calf cart or with some type of head restraint. So a lot of you have probably seen these things. This is just some different examples of restraint devices out here. This is a pretty nice one there in the middle that a lot of folks use. You can clamp that over a board or on a gate and allows you to put the calf's head in there in a way that it'll hold still. You're less likely to inject yourself with the needle. You're less likely to burn yourself with the dehorner or the disc butter if the calf's holding still. And they make all sorts of calf contraptions as a kind of a portable little calfy head chute, if you will, that can work pretty nice too. And again, like I said before, I've done plenty of them just tied to a gate with a rope halter, and that's fine, again, as long as we're doing these things young. You want to make sure that they're not going to flop around and injure themselves by getting a leg or a head through a gate, something like that. And obviously their head moves around a little bit more when we have them tied like this, and I have more than one burn scar on my wrist for where it slipped off and while I was putting it on there and got me. But we need to restrain as best we can in order to eliminate damage to ourselves as well. This is just an example of calf cart to make all kinds of sorts of these, and this is a pretty nice one where you can put the calf in. It's kind of like being in a squeeze chute. You can put its head through. It has a restraint bar that comes down over the head and works really great. And the good thing is, too, a lot of times we're moving these calves from maybe calving pen to the calf barn or something like that, and so it's got wheels on it. And when we're moving it, then we can dehorn it, and voila, we're done. And so just an example of some things that we use. There's dehorning paste, which I'll talk about in just a second. They make butane dehorners, so we can use those in the field. We don't have to have power. They do require a fair amount of maintenance to keep them working right, but they're quite portable. Butt-X is really great. A lot of my clients have Butt-X devices or some sort of a small hot iron dehorner that we can use on these calves. And if we can get them in the first couple of days, it's a lot less painful, and we're done. We're just done. So according to the AABP, they consider acceptable methods of dehorning to be cautery, scooping or gouging of small horns with a Barnes type. And again, we want to do them when we can still use those small Barnes types. But believe me, I carry all three sizes in my truck because sometimes we just need them. And we really need to get away from the guillotine type or the keystones. I have a big pair of keystones that we keep in the clinic, mostly so we can show the students how we don't want to do it anymore. That's why we have them in there. And again, elastic bands, we have to get away from putting elastic bands on there. Caustic paste, what about caustic paste? A lot of people are doing this now. I personally don't, but I have seen people do it, and I've seen presentations on it, and I think it's a perfectly viable option. You have to be very careful putting the caustic paste on to make sure that you use just a small amount. It doesn't take very much, and you only put it over the horn tissue, and then you need to protect them from getting wet, rain, licking it off, rubbing it off, and things like that. And so I have a little, this was done by Dr. Villarreal at the University of Oregon, or sorry, Oregon State, sorry. Hope there's no Oregon State people in here. Sorry about that. And this is a really good resource for doing this. And she presented this at AABP in St. Louis several years ago on a practice tip, and it works great for her. And so we can get these things when they're just a day or two old. We can feel the horn buds, clip the hair around it. You just need a very small amount of dehorning paste to put right over the end of that. Some folks like to put bag balm or some sort of cream around that too, so that it doesn't run off there, or it protects the skin tissue around the horns so that it doesn't burn any more than what we need to. And if we do this young, put it on right before we feed them. Put it on right before we feed them. Make sure you got the bottle ready to go, clip, prep, do that, and then feed them as soon as we're done. A lot of times, by the time, number one, that'll keep their mind off of the dehorning paste, and they'll be drinking. And a lot of times, by they're done, it's done eating. It's done a lot of its caustic activity already. And then, again, we need to make sure that we keep them wet. So, again, the keys, do them young, right? Do it right before we feed them, and then make sure they don't get wet. So which method is best? You know, should we be using the hot iron for disbudding? Should we be using the paste? Should we actually be scooping them out? While blood cortisols are not the end all of evaluating an animal for pain, there's problems with just looking at cortisol alone. Most of you probably know that. It is one of the things that we use to measure pain and measure stress in animals, along with thermal imaging and heart rate and some other things like that. But you can see with a hot iron that the cortisols will peak about a half an hour. They come back really fast. I mean, within 2 to 4 hours, blood cortisols are back. They stay a little bit higher, a little longer, typically with chemical disbudding, and then when we have to gouge them out, they're going to stay a little bit higher. So just based on cortisol alone, we'd probably say, well, a hot iron dehorning or disbudding, really, hot iron disbudding to a baby calf is probably the best thing we can do, at least as far as cortisol goes. But they're all not bad, and if we do them young and use some systemic pain relief, which I'll talk about in a minute, any of them are acceptable. Okay. What about Pol Genetics? I touched on that already briefly. There was just a study that came out not too long ago, kind of looking at what whether this was economical to be done in the United States versus dehorning, and this was mostly just an economic study, and I won't bore you with all of the details, but basically we're trying to see is it worth our time and effort to try to advance Pol Genetics, or should we just keep dehorning? And the results of that ended up being that basically it's about a wash as far as expense goes to the dairy. So I think that means to me that what it costs them to dehorn, and there's a wide range depending on when they do it, whether the farm producer does it themselves or has a veterinarian do it. There's going to be quite a bit of variability in cost from farm to farm. But bringing in Pol Genetics, at least it probably isn't going to be a lot more expensive, but it is going to take some time, and somebody's going to have to push that through to make it happen. Okay. If nobody has any burning questions about dehorning, we'll move on to castration, and I can try to catch your questions at the end. So as far as castrating cattle go, same method or same principle you're going to hear from me over and over and over again, just like disbudding, and that is that we need to do this at an early age as possible, right? The saying that I like to use is the longer the testicles are attached to the calf, the more the calf is attached to his testicles. Okay, so we need to get these things done and get them done early. Obviously, we want to prevent inappropriate breeding, and in a feedlot situation where they're going to be in with heifers and things like that, that can be a real problem when we have heifers that get pregnant that we didn't want to. And in many cases, it's necessary to meet market demands. Now, I don't do as much with beef cattle and certainly feedlot cattle as I do with dairy cattle. But my understanding is that there are some markets now for bulls, beef bulls, that are still intact, and so there may be, over time, we may see that develop a little bit more where we can go ahead and leave some of these things intact and not have a big market downside to doing that. But as of right now, I'd say generally speaking, we still need to get these things castrated. So AABP's position on this is again doing it young, and they recommend prior to 100 days. Obviously, there's going to be some purebred breeders that are going to say, well, you know what, Doc, I need to keep that thing a bull for 6, 8, 10, 12 months, maybe even I want to get a breeding soundness exam on him at 11 or 12 months and see whether he's going to be any good. And then if he isn't any good, we castrate him. Well, certainly by that point, in my opinion, we just need to let him go if we're going to wait that long. But AABP recommends it before 120 days of age. I have club calf, well, really not club calf, but feeder calf clients every year that always want that thing castrated at the last possible minute, right, before the fair, in order to get him healed up and still get him to the fair. And most fairs in Ohio and counties have individual rules, county by county or state by state, that have dates established when they can have those done. And they always say, you know, boy, if I leave them intact a little longer, they're going to grow a little better, and they're just going to. No, they don't. They don't, right? What primarily drives the growth of a bull over a steer, right? And that's testosterone, right? And we all know when puberty starts, and these things they haven't reached puberty at 3 or 4 months of age, and so leaving them intact longer makes no difference in my opinion, and I think medically it doesn't really anyway. And you know, even if we get a couple more pounds of gain on that animal in the first 5 months and then castrating when he's 600 pounds, he's going to go off for about a week, and we're probably going to lose everything that we gained by leaving him intact longer. So I always try to convince them, you don't need to do that. Get them done early. They'll be off and rolling. You'll get that gain back, and you'll be the same thing at the end of the fair. I already showed you this again, AABP's statement about restraint. Obviously, we need good restraint when we're doing this to help prevent injury for the animal and also for us. So a chute's great, some sort of a squeeze chute with a head catch is really great for castration. AABP's position on it is the use of a rubber ring or surgical removal is preferred, but you have to look at the operation, you have to look at the system and see what's best. If they're going to be in a really dirty, really muddy setting after that, that may influence what we do. What the client prefers usually has some bearing in it too, and that's up to the veterinarian to decide and work with them. But getting it done early, I think, is where we need to be with this too. So an elastrator band at birth, I think, is a great way to go. There's really no reason that we can't be castrating these calves within the first 24 to 48 hours old. And my beef clients all tell me, oh no, I can't do that, it's born out there on the back 40. And I said, yeah, but you go out there and you slide a pill down it for E. coli diarrhea, and you put a tag in its ear before it can even hold its ear up, right? And maybe you give it a vaccine and dip its navel. Pop this on there too while you're out there. You can get this done. And so if you're not going to keep that thing as a bull, let's get them off there. They make calicrate banders. So this is the elastrator band that we use for, sheep and goat castration or tail docking in sheep, but works fine in calves too. They make a calicrate bander for bigger animals, which is an acceptable thing. We'll talk a little bit more about pain management and stuff in just a minute, but obviously it's going to be a little more painful for the bigger animal. But if done with proper local anesthesia as well as systemic pain medication is quite an acceptable way to go. We have to protect against tetanus when we're doing this, right? I preach that to my vet students all the time, that in my opinion, if we're going to put a band on anything and we don't have proper tetanus protection, shame on us. We really need to do that, whether that's tetanus protection through maternal antibodies, through a properly vaccinated mama, and assuring good colostrum intake, or whether we cover ourselves with vaccination, whether it's toxoid or antitoxin to the calf. We need to make sure we've got tetanus protection if we're going to put a band on anything. Should have it with any type of castration, but especially a band. For the first several years I was in practice, the only time I ever saw tetanus in a calf was something that had a band on it. And I always tell the students, certainly that doesn't mean that everything that gets a band on it gets tetanus, because it doesn't. We wouldn't do it, obviously. But that's the majority of my experience with tetanus. I've seen it in a few adult cattle too, postpartum as well, and so they can get it. But it's a concern. Surgical castration is a great way to go. It's what I prefer whenever I'm doing it, and maybe that's just because I like to cut things, I'm not sure, but somehow doing a surgical open castration, whether we're removing the bottom third of the scrotum, just taking that clear off, whether we use something like a Newberry knife there on the right to open vertically in the scrotum, we're going to open it somehow, and then we're going to remove those testicles surgically, is also a good option. Obviously, there's more risk of hemorrhage with this over a banding, but it's also, you can be sure that you got it done. If you do it properly, hemorrhage is pretty minimal, and these things, I think, heal up really well and really fast, and at least empirically, they seem to trot off to the feed bunk pretty quick after this, or go back to nursing or whatever. So certainly a good option. Here's surgical castration, open castration being done with an emasculator. I rarely use an emasculator, but certainly we could, especially on some bigger calves. So similar to how we might castrate a horse with an emasculator that we leave on there for a couple of minutes. And you can see in these bigger animals, we probably really need to be offering some generalized sedation for these things if we're going to do them real big. This is a small survey of veterinarians, but in Kansas, but even though the numbers are fairly small, I think you get the idea that by and large, as veterinarians, we do surgical castration when they're small, and as they get bigger, we do less surgical castration, and as they get bigger, we do more banding, and that's probably true in our practice as well. Not really sure what this one person right here is doing the other technique, but they're doing other technique regardless of cattle size. It's not crimping, because we have Burdizzo crimping right there, so not sure what that is, but there's some other out there. So, okay, so let's talk about pain management. How am I doing on time? Am I okay?
And we're about out.
We're about out of time? Oh no, I'm sorry. I'll be fast. Is that okay?
That's okay.
All right. This is important. This is the important stuff. So we should keep in mind, and this is ABP's position statement, that castration and dehorning are painful, and we need to provide some sort of castration. According to the Ohio Livestock Care Standards, we need pain management has to be used once that horn has erupted, and when we're castrating, we need to take into account the animal's weight. Local pain management, most of us are going to do a cornua block right under the zygomatic arch, about halfway between that lateral canthus and the base of the horn. I won't bore you with the vet student details of the technical procedure there, but so use of local anesthetic is a great way to go, whether we're talking about dehorning or castrating. Adding a little bit of sodium bicarb, 1:10 ratio with the lidocaine takes the sting away. So I always recommend that. You have to mix it up right before you do it, or it's going to precipitate out. But adding that, especially, and I know I wasn't supposed to talk about cattle, but especially in lambs and goats, I think that's even more important. So sometimes we have trouble getting them to do, especially if we're running a bunch of cattle through the chute. They don't want to take time to do the anesthetic. We have to work with our clients to train them that they need to redo that thinking. It takes effect really fast. It just takes a couple more seconds to pop that local anesthetic in there before we do the procedure. This is some work that Hans Coetzee did, University or at Iowa State, and basically just looking at cortisol levels compared to doing nothing, okay, compared to controls. And so local anesthetic, you can see that it's better than doing nothing, but when we use a systemic pain reliever, a non-steroidal plus a local, that's the best. That gives us the best, even compared to a systemic. So local and systemic as well is the best way to go. I would like you to watch this video, if I can have a couple minutes. This is work that was done at Iowa State. I'll see if it'll go on local pain reliever for testicular block. And so there's no sound to it, so I'll narrate a little bit, but this is probably where we need to be, and I've started using this quite a bit when we're castrating cattle especially. So this involves a local block of lidocaine over each cord and then also in the base of the scrotum where we're going to remove it. It does add about 30 seconds to a minute on to the whole procedure length, but that's a relatively short amount of time. All you need is a needle, syringe, and some some lidocaine, to do the local block. This is there's going to be a video here in a minute of somebody wearing a GoPro castrating a calf, which is pretty cool. But now this calf is being tail jacked. It's a little hard to see in the video, but it is being tail jacked also in the chute. But you can see the thing hardly even moves its feet at all. So somebody tail jag it, that's mostly to keep your face from getting kicked in while you're injected. But if you use a relatively small bore needle, 1 cc per 100 pounds right into each cord, easy to palpate, inject them, come in from the side, inject some in the distal end of the scrotum. They're going to remove the scrotum the same way I usually do, and that's with a mini hand scalpel, just removing the bottom third of the scrotum. Opens up the testicle. Now, whatever procedure you went to from here would be up to the veterinarian and what the producer wants also. You could certainly do emasculator clamps here. You could certainly do pulling, which is what I do on a lot of the smaller ones, is just retraction of the testicle. Here he's just cleaning off the connective tissue around each testicle. They're going to use a Henderson castrating tool in this example, which is like a giant forceps that's attached to a cordless drill. It's becoming pretty popular. We have one in our practice too. I've used it a few times. You can see where the local block was actually done right in the cord. Clamp that on there, and then this just spins and it'll twist it right off. And you can see the calf hardly even moves at all while we're doing this. So a pretty good option, regardless of what technique you're doing. And quite honestly, if we're putting bands on big calves too, even if we don't do open surgical castration, injecting some lidocaine into the cords at the area we're going to put the band on is, I think, preferred. So I like that with lambs. I like that with calves. We do a little local block with a little lidocaine right in there. before we put the band on. So we've used for a long time, we've used things, non-steroidals, like flunixin. Obviously, we have to give those IV. That brings about some complications, especially if we're working a lot of cattle through a chute or something. We have to keep in mind it's not labeled for pain relief this way. It's labeled for fever control, for endotoxemia, and for endotoxemia with inflammatory processes like mastitis. Meloxicam is kind of the new thing that everybody's using now. I guess this is the probably newest idea I can bring, and it's not all that terribly new, but it's becoming certainly much more popular. I keep some in my truck all the time, and I'm using it almost every week. Now, this was all based on mostly work that Hans Coetzee did, looking at this, a human anti-inflammatory, but a mg per kg is kind of a general dose, whether we're using it orally or IV or IM, and it makes a great pain reliever. And the half-life is something like 27 hours, so we can usually get an effective dose up to about 2 days with this. So if we're going to dose it for a more chronic condition, I usually dose it every other day, but a single dose for castration or dehorning, by the time this is out of their system, that cortisol's usually come back, and they're usually, it's all done. We have to keep in mind that this is all extra label. It's permissible under AMDUCA because we don't have anything else. But regardless of what we're using, Meloxicam or Banamine, it's going to be extra label. But Meloxicam at the time of castration, at the time of dehorning, is a great way to go. If you can do it the morning before the dehorning in the calves, that's even better. But it's not necessary. So this is just a graph to look at cortisol levels. Again, this is Hans Coetzee's work, but cortisol levels with the different types with castration, and where we really need to be is a local anesthetic plus a non-steroidal. So whether it's a dehorning, whether it's castration, a local block, as well as systemic anti-inflammatory, and Meloxicam, I think, is the way to go. It's really cheap. It's pretty easy to dose. It lasts for a couple of days. That's where we need to be.